we move on to viral hepatitis, and this talk is really designed at what should happen at primary healthcare level. So it also includes the nurses as well, and like Sis Tabile has said, that it's going to be a full day training in your provinces. So this will be just an overview. We will by no light get into the analysis of your liver, enzyme analysis. All of that will need a full day to understand. Okay. The outcomes, as far as this particular section will be concerned with, will be to describe what viral hepatitis is and the potential of the health complications, to understand the transmission as well as the risk factors that are there when it comes to especially hepatitis B and C, okay? Explaining the importance to your participants especially of the hepatitis B birth dose and the rationale behind it, and we will discuss it in this session, as well as the health worker screening, which is important. It's important to know what the dosages are going to be, all right, for the vaccination, how long the healthcare worker will be covered for post the vaccine, and how do we know that they have received immunity. Understand the principles then of prevention in terms of the screening, assessing, and managing a hepatitis B and C. Recognize the importance of the needle and syringe services, as well as what we call OST, which is your opioid substitution therapy given to your intravenous drug users. Understand the links then between a co-infected patient with either HIV hepatitis B co-infection or HIV hepatitis C co-infection. Know what resources are available, especially when it comes to drug-to-drug interactions of a patient who has or is going to be on therapy for hepatitis B or C. Further to that, it's then important to highlight the importance of viral hepatitis elimination, an introduction to the needle and syringe services, how they will work, which metros are already covered, and what the program looks like. What is used for the opioid substitution therapy? This is obviously when we are assisting an intravenous drug user to actually start to withdraw from the habit. Hepatitis B viral key elements of diagnosis and managing it, including co-infection with HIV as well as with hepatitis C. We'll also have a snapshot of your hepatitis A, D, and E in this particular session, as well as discuss our resources. So if we look at hepatitis itself, it's obviously the inflammation of the liver through inflammation of your hepatocytes, and we know that the liver is responsible for many cycles. And when a patient goes into liver failure, especially decompensated liver failure, those are also affected. And this contributes to the type of screening we will do for this patient as we manage them. So the liver itself is a detoxifier, right? A lot of your medicines and alcohol, substances are detoxified there. It's there for production of your blood clotting proteins. About 11 of them can be produced there. Breaking down of nutrients, a lot of our cycles, like your carbohydrate cycle, takes place. The conversion into fatty acids and storage into adipose, as far as the fats are concerned, are also controlled in the liver, as well as your ammonia breakdown. And there's other functions that the liver is also responsible for. So the approach then to hepatitis is as we've been taught in our undergrad, right? Either the patient has got it because of toxins, they've got it because of like drugs, it can be because of an infiltrative condition, right? Or it can be because of anything else like a virus or a bacteria or a parasite, right? And when it comes to hepatitis, it can be cholestatic or it can be due to your actual liver cells being affected. The course of the disease, the patient can go into acute infection or chronic infection. And when you analyze the antigen-antibody analysis, when you are investigating your patient, it will help you to know which phase of the infection they are in. and you would evaluate specific antigens within the actual spectrum, right? So if you look at your acute infection, you'd be looking at your hepatitis surface antigen being quite important, your hepatitis core antigen being quite important as well. And then your chronic infection centers around your hepatitis E as well as your hepatitis viral DNA levels. So like we said, we won't go into too much detail as far as that is concerned. So your acutely infected patient can be asymptomatic. They, if asymptomatic, would have your signs of jaundice, dark urine, extreme fatigue. They'll be nauseous as well as have vomiting and abdominal pain. A small proportion would then develop acute failure and even death. Your chronic infected patient may be asymptomatic. They can have malaise, fatigue, anorexia, and a vague abdominal discomfort. And signs of cirrhosis or chronic liver failure can result, and they can then progress to hepatocellular carcinoma. So this is really what would happen. You've got a chronic hepatitis patient with liver scarring continuing, they would go into cirrhosis. Now the cirrhosis can be compensated or decompensated cirrhosis and then eventually lead to either death or move into hepatocellular carcinoma. Note that we've also got the silent carriers, right? And about 20% of patients would be that as far as when they have been in the acute phase is concerned. So your viral hepatitis can be eliminated, that's an important message, through vaccination against hepatitis A and B, and the prevention of mother-to-child transmission is also quite important. Avoidance of contact with infected blood and blood products is important. Rationale of the use of safe medical injections as far as your IV drug users are concerned. Consistent condom and lubricants use, avoiding and sharing needles and toothbrushes, razors and nail scissors, sterile injecting equipment, and then embarking on your opioid substitution therapy for those who are injecting drugs. Hepatitis A and E, because they've got a fecal-oral route, it's important to emphasize the washing of hands, safe food and water, as well as safe sanitation. Management then for hepatitis B hepatitis B can be effectively controlled. Fortunately, when it comes to an HIV-positive patient, the actual triple therapy that we've got has got the nucleotide analogs that can treat and stabilize the hepatitis. As far as hepatitis C is concerned, it can be cured, except currently the therapy is not readily available, but a submission has been done. When it comes to the vaccine for hepatitis B, remember that especially for healthcare workers, you would get an immediate dose. You'd get a dose after the first month. You'd get a dose at 6 months. And then post the 6 months dose, 2 months after that, you can check the titers, all right? And if there are more than 10 international units per mil, then you have gone into immunity and it's lifelong. Important because as healthcare workers, we need to understand we have to be vaccinated, yes. So the reason that there is this new guideline that will come in is because it's being based on the 2015 World Health Organization targets, which have said that we want a 90% reduction of new hepatitis B and C infections. We also want to reduce the deaths by 2030 by 65%. So as a result, there's now a guideline that you will be taken through, and it was finalized already, I think, in June. All right. So the priorities then would be centered around the hepatitis B virus birth dose vaccination, in addition to the ones you would have been giving for EPI. All right. Health worker screening and vaccination and health worker training would be a part of it. Then there's the expanded hepatitis C treatment, including services for people who are injecting drugs, who are more at risk in this light, as well as raising awareness regarding hepatitis B as well as hepatitis C. Our current prevalence in South Africa is about 7%, and it also depends on the age group in terms of who can easily move from acute hepatitis B, especially, to chronic hepatitis B. The needle syringe services is for people who are injecting drugs. And I think if you look back, we were never a country that was highly concerned with that. We would be more around, because our spread was largely heterosexual, right? But now the needle exchange programs that need to start, that need to continue, are now in place, especially in about 8 metros. These services can be mobile or fixed. Provision of needles and syringes and other equipment will be given to those that are injecting drugs, with education and HIV and viral hepatitis screening and referrals being a part of it. It includes the mechanism as well of collecting safe and your used needles. And over 20 years of research confirms that it does not increase the drug injecting rates, because there's always a question of, are we not promoting the actual behavior? But I think this is more a prevention rather than promoting. Okay. Your opioid substitution therapy, these will be drugs that are used to assist intravenous drug users to wean themselves off the IV drug use. And then it makes them less likely then to be the risk population for contracting hepatitis B or C. If we look at the immune response to any viral infection, we know that at viral exposure, you have an antigen-antibody complex that would form. Now, when it comes to hepatitis B, the analysis of antigen and antibody becomes important to note, firstly, whether the patient is in acute phase or chronic, and also to understand which patient needs therapy, and then also that analysis tells us which patient is more likely to be going into liver failure as well, all right? When it comes to your hepatitis C, your antibody analysis is what we would use mostly. So it's less complex in terms of analyzing the management in the patient as well.